Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
The purpose of this tape is to demonstrate live the use of two communication skills that help people understand each other better by reducing the amount of communication distortion between them. In the scenes that follow, we apply these two skills to dental situations that often occur in daily practice. The two communication skills of paraphrasing and perception check help us check out whether our message is being received the way we intend it. They help us, the speaker, know what the other person is understanding from what we say, content message, and how he or she thinks we feel about it, feeling message. When you paraphrase, you state the other person's idea in your own words or give an example that shows what you think he or she is talking about. A good paraphrase is usually more specific than the original statement was.
I think Nancy is unfit to be a receptionist.
You're saying that she's not right for her job?
That paraphrase was too general. If Sally agrees with it, Natalie will not know what she means by unfit. She will have the illusion of understanding. Let's see what happens when Natalie paraphrases more completely.
I think Nancy is unfit to be a receptionist.
Oh, you mean that she doesn't have the outgoing personality to greet patients?
Right. She doesn't have the outgoing personality, and she just is too stiff around the patients.
Now I know what you mean when you say that she's unfit for her job.
By the use of paraphrasing, Sally and Natalie have gone through the process of narrowing the arc of distortion between them and established a shared meaning of Sally's original statement.
Good morning, Mrs. Rimsberg. What seems to be your problem today?
Doctor, this tooth right here has been bothering me all night, and it really caused me problems when I ate breakfast this morning.
I see. Are you saying that it's giving you a lot of pain?
Here the doctor's paraphrase is too general. Giving you a lot of pain doesn't clarify precisely what kind of problem the patient is having with a particular tooth. Let's see what happens when the doctor paraphrases more specifically.
Doctor, this tooth right here has been bothering me all night, and it really caused me problems when I ate breakfast this morning.
Are you saying then that the tooth feels sore to you and it's taller than the other teeth when you bite down on it?
Yeah, that's exactly how it feels.
This time the doctor's paraphrase was more specific. The patient agrees with the doctor's rewording of his original statement. Thus, they now have a common, agreed-upon understanding of the patient's problem. This will aid the doctor in continuing his diagnosis and give the patient a feeling that the doctor understands and can deal correctly with her situation. In other words, this paraphrase leads to clarification of the way that the patient is using the words bothered and caused me problems, eliminating communication distortion between the doctor and the patient. You can get the other to clarify by asking, "What do you mean?" or by saying, "I don't understand." However, when you paraphrase, you should show what your present understanding is and thus enable him to address his clarification to the specific misunderstanding you have revealed. Before you agree or disagree with a remark, you should make sure that the remark you're responding to is really the message the other is sending. Paraphrase is one way of testing this. In a good perception check, you state what you perceive the other to be feeling. A good perception check conveys this message: I want to understand your feelings. Is this the way you feel about it?
Today at the office meeting, nobody said anything when I suggested a new, more efficient procedure for setting up trays.
Am I right that you're feeling disappointed that nobody commented on your suggestion?
Yeah.
Let's look at another interaction later on that same day between these same office personnel to see how a perception check can help clear up bad feelings between people and lead to a clearer understanding of each other's point of view.
Hey, will you move over? I'm in a hurry.
Sally, I get the impression that you're angry with me, are you?
No, I'm not angry at you. I'm just rushed and frazzled by all of these patients at once. It's a mess.
In Natalie's use of a perception check, 1, she identifies Sally's feeling of anger, and 2, she does not express disapproval or approval of the feelings. The perception check merely conveys, "This is how I understand your feelings." Am I accurate? Okay, let's switch to a different scene to see how the use of a perception check can help the doctor establish rapport with his or her patient when the patient is in a stressful situation.
Doctor, this tooth here is really hurting me, but I don't think I want to have it taken out.
Well, Mrs. Curtis, I can assure you that I will do everything that I can to save the tooth.
Here the doctor has responded to the patient's concern by giving information. This information is certainly important and could be used by the patient in the future. But right now, the patient is not able to respond to it because her feelings are most salient. The doctor at this point still doesn't know what the patient's feelings are about the situation. Let's see what happens when the doctor makes use of a perception check.
Mrs. Curtis, are you saying that you are afraid of the pain that comes from the procedure?
Yes, I'm really scared about it, and I'm afraid it's going to hurt even more to have it taken out.
This time, by checking out the accuracy of his perception that the patient is afraid of the dental procedure, the doctor shows the patient he is in tune with her feelings and also gets data that can aid him in dealing with the patient's fear. For example, the doctor might go on to explain the procedure to the patient and discuss the amount of pain involved and how it will feel to the patient. Perception checks are crucial to clear communication. Often your perception of another person's feelings result more from what you are feeling, or are afraid of, or are wishing for, than from the other person's words, tones, gestures, facial expressions, and so forth. If you feel guilty, you might perceive others as angry or accusing toward you. Our inferences about other people's feelings can be, and often are, inaccurate. So it is important to check out our inferences. Perception check responses aim to, 1, convey that you want to understand the other as a person, and that means understanding his or her feelings, and 2, perception check responses help you avoid actions that you later regret because they were based on false assumptions of what the other was feeling. Your aim should be to let others know what behavior you are responding to by describing it clearly enough and specifically enough that they know what you observed. To do this, you should describe evidence that can be seen, behavior that is open to anyone's observation, rather than a suggestion of unfavorable motives. Let's observe this process in Dr. Jones' office.
One of the patients didn't show up this morning, so I took that time to reorganize the drawers. See what I've done?
Great. That really needed to be done. I'm glad you took the initiative.
Why did you put the headrest covers in the bottom drawer when we use them so often?
Well, my thought was that we never really need them in a hurry. It's not something that Dr. Jones would ask for while he's working. Besides, something has to be down there. I'm sorry you don't approve, though.
I'm going to go to the lab and trim some models. Would one of you like to come with me?
I will. I'd like to make that custom tray for Mrs. Taylor.
Is that really necessary? I think there are more important things we could be doing this morning.
Anne, you're just trying to show up Martha.
No, I'm not. That's not a very nice thing to say.
Nancy's statement was not a description of behavior, but an accusation of unfavorable motives. Anne responds defensively, which does not lead to improved communication between the two. Let's return to this scene to observe how Nancy's use of behavior description can change Anne's response.
Is that really necessary? I think there are more important things to be done around here.
Anne, you seem to be taking the opposite point of view of everything Martha says today.
Is that what it looks like I'm doing? I'm just trying to show everybody around here that I know what needs to be done in the office, too.
In a behavior description, your goal is to let others know what specific behavior you're responding to by describing it clearly and specifically so that they know what you observed. To do this, you describe evidence that can be seen behavior that is open to anyone's observation. As we have seen, accusation of unfavorable motives is one common way that people use to deal with other people's behavior that upsets them. Another common way, naming a trait in a person without giving any behavioral evidence of it, can also lead to misunderstandings, as we see in the next scene.
I believe we need a more organized system for routing materials when they come from the lab. Do any of you have suggestions?
Well, it seems to me that we could take the prescriptions
Boy,
and...
we really have messed them up in the past, haven't we?
Yes, we certainly have. Nancy, you were saying something about it.
Well, instead of just having the name on the prescription, we could also sort them in the lab according to appointment times.
Oh, and we could just reach for the
Yeah, that
prescriptions.
sounds like a great idea. I could start doing that later today. I'm going to run down and get some of the...
Martha, you're so rude.
Here, Anne labels Martha as rude without spelling out how Martha is behaving. Anne implies that Martha interrupts because she is rude and has no manners. But Martha might not be interrupting on purpose, but merely out of enthusiasm. Let's have Anne try a neutral behavior description instead.
That sounds like a great idea. I could start doing that later today. I'll run down and get the materials.
Martha, I've noticed that several times when other people have been speaking that you've interrupted them.
Oh, I didn't even realize I was doing that. I just got really excited about the idea. I'm sorry.
To develop skill in describing behavior, you must sharpen your observation of what actually did occur. As you do, you may find that many of your conclusions are based less on observable evidence than on your own feelings of irritation, insecurity, or fear. Thus, accusations or labeling others is usually an expression of feeling on your own part. We have dealt with behavior description as a skill which helps others know what behavior you are responding to in them by describing it clearly and specifically. Description of feelings is another communication skill which lets others know how you are feeling about their behavior. To make clear what feelings you are experiencing, you must name or identify them. The statement must, 1, refer to I, me, my, and 2, specify some kind of feeling by name or figure of speech. The following scene presents first an emotive expression on the part of one actress, then an attempt on the part of the other to describe the feeling in that expression, and finally the actual identification of the feeling.
What was the guy like that you went out with last night?
Just great. He's really a wonderful person.
Does that mean you're in love with him?
No, I just enjoy his company.
Another example might be,
Where is that Anne?
Hi, Martha.
Anne, can't you ever be on time?
I'm sorry. Are you irritated because you had to set it for the first patient without me?
Yes, as a matter of fact, I am irritated.
here Anne helped Martha clarify the feeling behind her complaint, which allowed Martha to communicate in a more direct way. Here is another scene where clarifying a feeling by describing it leads to ambience rather than discord in a working relationship.
Oh, hi, Martha. Did you enjoy your coffee break?
Yes, I did. Oh, but you shouldn't have done my share of the work while I stepped out.
Do you resent it because you feel obligated to me?
Oh, no. I'm just very appreciative. Thank you.
You're welcome.
Feeling is expressed not only through abrupt commands like, shut up, through questions such as, why can't you ever be on time? And judgments about a person's traits such as, he's a wonderful person, but also through blushing, sighing, crying, by becoming silent, by keeping another waiting, and so forth. It is therefore important to describe your feelings, which is less ambiguous if you want others to understand accurately how you feel.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.